Okay, in the final section, we're going to talk more about nursing care. And we've talked already about nursing care and those acute emergencies. But beyond the acute emergency, our major role is education. There are organizations that spend billions of dollars to collect data about diabetes, research diabetes, and to educate patients. So use those resources, refer patients to those resources. The American Diabetes Association, Canadian Diabetes Association, Juvenile Diabetes Research Foundation, and American Association of Diabetes Educators are for those organizations. In an acute situation, we have a newly diagnosed diabetic patient who is in the hospital on our unit. Or maybe they've been discharged and we're the home health nurse. What do we teach them? There's so much to learn. There's this really big, massive area of information for how to manage diabetes perfectly. Just like in nursing, there's a whole lot to learn and you're filling in little pieces. So your patient who's diabetic is going to spend years filling in little pieces and learning about the disease and learning about how the disease affects them specifically, because people have individual responses. So what is the highest priority teaching need? The very first thing you've got to teach that patient is how not to die. Okay, we want to teach them what are the signs and symptoms of hypoglycemia and what to do about it. What are the signs and symptoms of DKA or HHNS, dangerously high hyperglycemia, what to do about it. Okay, we want to teach them how to take their meds safely, how to give the insulin injection safely, how to change out the pump safely, how to take their oral meds safely. We want to teach them how to take their meds safely. And then we want to teach basic diet. Okay, so a really basic how to eat as a person with diabetes is actually a really healthy way for all of us to eat. The majority of the carbs that we eat should be complex, more complex than simple. We want to minimize simple sugars, not 100% ban them because that doesn't tend to be effective, but we want to minimize them. And we want to encourage them to balance to space their carbs throughout the day, not eat all at once. They don't want to eat one meal a day and eat all of the carbs for the whole day. That's going to be really hard to manage. So space their carbs through the day and to balance that with lean proteins and unsaturated fats. Okay, that's the basics. And we can help them begin to be able to identify what's a complex carb, what's a simple carb. How many grams of carbs are in this particular meal? Because for some patients, they're going to be counting carbs and administering insulin based on that carb count. So that's the very basic diet stuff. And then they can branch out later to, okay, I'm on vacation or I travel for work. How do I eat on this job? How do I eat in a fast food restaurant? How do I eat at a birthday party? So basic diet, how to monitor their blood sugar, how to check their blood sugar, and then what to do if they get sick with something else. That's the very basics. And from there, they branch out. So ongoing, we want to teach them how to manage their blood sugar more carefully, like optimum management, how to prevent complications, expanding their ability, their dietary options and their activity level, and transitioning to independent life. Especially for people who diagnosed in childhood, they have to be able to transition safely to living as an adult. We may also be giving psychosocial support. There's often a honeymoon phase. People are shocked by, oh no, I've got diabetes. And then, okay, this is manageable. People do this. People live with this. And so they're like, I'm going to be the best diabetic ever. I'm going to eat exactly what I'm supposed to eat. I'm going to always take my medicine. I'm going to be perfect diabetic. And then they get tired of it because it's exhausting to have to keep that up every single day. Okay. So diabetes doesn't go away. So then they may kind of fall off a little bit on how well they're managing blood sugars. Parents can be overprotective and anxious, which when we get to adolescence, if we have overprotective parents, what are adolescents trying to do? They're trying to separate from those parents. So they may choose diabetes management as a way of rebelling or individualizing from their parents. And we want to really help families avoid that. Adolescents may also have a hard time being different from their peers. They may struggle with needing to take a shot in class or excuse themselves, needing to leave class to have a snack, those kind of things. And sometimes they may get some pushback from authority figures and from peers about those things. I remember when I was in school, there was another student with type 1 diabetes, and a sub would not let them go have their snack. So they ended up with dangerously low blood glucose. So one of the things we might be doing is helping parents come up with a diabetes plan. Now, specific treatment plan has to come from the provider, but we can help them come up with how to present that to the school. Nursing care when they're admitted, we need to know and make sure that families know. Illness, hospital admission, and stress can change insulin requirements, and the inpatient diet can be different from what they eat at home. One of the things that we've seen, especially with patients who tend to not follow their diet carefully, is their insulin doses have been increased to cover eating whatever they want. When they come to the hospital, we put them on a 2,000 calorie ADA diet, and their blood sugar is low all the time because they're getting insulin based on what they eat at home, which is a lot more simple sugar and not what we're feeding them. So sometimes adjustments have to be made that way as well. Okay, in class, we're going to do some education planning. We're going to look at insulin drip. We're going to do a lot of interesting things in class. You guys have had some experience with diabetes, so I'm really looking forward to what you come up with.